This is Putting Veterans First, a presentation of the National Veterans Rights Association. NVRA is an organization with one thing in mind, putting the rights and best interest of our veterans first and foremost. This program will provide guidance to the 60,000 homeless vets seeking help, to the millions denied benefits, to the families of more than 17,000 vets annually who commit suicide. Putting Veterans First is hosted by Stu Steinberg, a veteran who served in Vietnam as an explosive ordnance disposal specialist from 1968 to 1970 and a volunteer service officer for Vietnam Veterans of America since 1978. Now, here's Stu Steinberg.
Well, this is my first podcast in quite a while, and to tell you the truth, the main reason is that I've just been really busy doing VA work for my fellow veterans, and so I finally got around to doing this, and I guess that, the thing that finally drove me to doing a new podcast is all of the various problems and just absolutely wrong things involving the VA that have come to light, for me at least, in the last few weeks. Today is May the 21st, 2015, so this is going to cover a fair amount of ground. And there are so many things I could talk about, but I'm going to stick with discussing some of the really egregious examples of mismanagement, negligence, maybe even criminal actions by various agencies of the Department of Veterans Affairs. When we were all blown away by the magnitude of the problems at the Phoenix VA Medical Center, I somehow missed a similar and equally deadly situation occurring at the Dorn VA Medical Center in Columbia, South Carolina. In fact, the Dorn debacle occurred more than a year prior to the Phoenix situation becoming publicly known. In short, veterans died because of the gross negligence and cover-up perpetrated by VA officials about the gastroenterology clinic at Dorn over their backlog on requests for appointments, some 3,800, at least 700 of which were for critical situations. And even though Congress appropriated emergency funds of $1,029,700 to alleviate this problem, particularly for known cases of potentially terminal illnesses, no effort was made to address the problems that resulted in at least 6, possibly more than 20 deaths of veterans who were either misdiagnosed or not diagnosed soon enough. In fact, CNN discovered that of the more than $1 million in emergency funds to deal with this problem, only a third of these funds were used to pay for care for veterans on the waiting list. No one, least of all the VA, has explained where the rest of this money was spent. Let's be clear. Between Dorn and Phoenix, as many as 60 veterans died while waiting for care. The investigators of the Dorn situation found that of 280 GI cancer cases they looked at least 52 were, quote, associated with a delay in diagnosis and treatment, end of quote. Even though Dorn knew as early as May 2011 about the problems of delays in diagnosis and treatment in the GI clinic, absolutely nothing was done to cure these problems until a VA internal investigation and a VA IG investigation, both occurring in 2013. That's right, it took 2 fucking years before any sort of investigation was done, and to this day it appears that nothing has changed. People who know me know that I talk the way I think, and I've tried to keep these podcasts down to a minimum of swearing and, using obscenities, but I'm sorry. Using the F word as I just did, there's just no other way, to state this situation. Now, there were 2 investigations of this despicable criminal situation at Dorn. The first, published on March 25, 2013, was by an administrative investigation board made up of 5 VA medical people from 5 different healthcare systems. The second investigation was done by the VA's Office of Inspector General and was published on September 6, 2013. I have read both of these reports over and over and have come to the conclusion that they are both completely full of crap and never actually address the issue of VA employees' actions that resulted in the deaths of veterans. I'm not kidding you. There's not a single word in either of these reports that addresses the question of why and how these veterans died, as far as I'm concerned, were killed by actions and inactions of people working for the Department of Veterans Affairs. In the report by the Administrative Investigation Board, they specifically asked this question: did any actions or inactions in connection with the management of the GI clinic contribute to adverse patient care outcomes? In the conclusions to this section of the report, that question is never answered or even addressed. This purported investigation, which never investigated the causes of the deaths of veterans, is a deliberate, fallacious action that deserves nothing so short of complete contempt. In the so-called facts segment of this question, there are 9 facts that are stated. That's right, there were only 9 facts needed to address a situation leading to the deaths of American veterans. In fact, no pun intended, facts 3 and 9 are the same and were made by the same person. What the fuck? Did no one read this pile of garbage before they published it? In the 30 pages comprising both reports, the administrative investigation and the IG investigation, that's right, 30 pages in what should have been a death investigation, no actual findings were ever made in either of these reports about who and what caused the deaths of possibly more than 20 veterans. In July 2011, a hospital physician at Dorn sent a warning to hospital administrators that the backlog for GI appointments had reached 2,500 and patients were waiting 8 months until February 2012 for appointments. By December 2011, documents recovered by CNN show that the backlog at the GI clinic at Dorn had grown to 3,800 patients, and this was noted in another warning email from a VA physician. In the September 2013 IG report, the IG affirmed the delays at Dorn in stark language, stating that at least 700 of the delays for appointments or care were, quote, critical. Dorn and Phoenix are not the only VA medical facilities where the gross negligence of this warped system has caused the deaths of American veterans. Shortly before the November 20th, 2013 CNN story about Dorn, the VA acknowledged that there have been concerns about the delay of care at other VA facilities. At the Charlie Norwood VA Medical Center in Augusta, Georgia, at least 3 veterans died as a result of delayed care. Internal documents that CNN reviewed show that Norwood had a waiting list of, get this, 4,500 patients. Investigations into lengthy delays in care were also conducted at Atlanta, North Texas, and Jackson, Mississippi medical centers. It also turns out that although Dorn and Phoenix brought these despicable problems to the fore in 2013 and 2014, this problem is not new, and both the VA and Congress have known about these issues for years and done absolutely fucking nothing to change them. A December 14, 2014 healthcare inspection at Dorn showed that only 2 of the 12 problems that were identified as being responsible for the delays had been addressed. This is despite the claims of shock and wrongness by various members of Congress, including Jeff Miller of Florida, chairman of the House Veterans Affairs Committee. Talk is cheap, Mr. Miller, yet neither you nor your committee or the Congress as a whole has done a single thing to end, once and for all, these criminal actions on the part of numerous VA officials. The same is true for the new head of the VA, Bob McDonald. This follow-up report of the problems at Dorn were apparently asked for by both the Senate and House Veterans Affairs Committee, and yet, 5 months later, the other 10 recommendations remain unresolved. In fact, shortly after the Dorn debacle became public, Mr. Miller and other members of the Veterans Affairs Committees went to Dorn and made a big, splashy public display of their visit. Since then, Congress has done virtually nothing to uncover the complete truth about what happened at Dorn and the other VA medical facilities that have lied about wait times and covered up the truth. No one has been fired, no one has been charged with crimes, and the Choice Card program is a laughing stock. Yeah, I mean, to the extent that the Choice Card program was supposed to address some of these issues, it has not, and it never will, because this program is just completely screwed up. The VA, instead of making it easy for veterans to use this program, have instead denied most requests for use of the Choice Card and now wants to use the money Congress gave them for the program for other uses. The only thing Congress has done to force the VA to make this program as veterans-friendly as possible is to force the VA to calculate mileage to the nearest VA facility as the actual road miles in not a straight line as the VA was using to calculate mileage. Then, there's the whole issue of what the nearest VA facility is actually capable of providing in terms of medical services. In one case, a veteran was denied use of his choice card for an orthopedic problem because there was a VA dental clinic within the 40-mile radius the veteran needs to be beyond. Last time I checked, dental clinics don't provide orthopedic services. So this clinic shouldn't have been used at all to see if this particular veteran was eligible for using his choice card. Congress has done nothing to fix any of these problems. Worse, even when they do take small steps to fix problems, the VA typically just ignores Congress, and Congress never does anything to punish them. According to the Government Accountability Office, quote, long wait times and scheduling policy and process have been persistent problems for the VA, and both the GAO and the VAIG have been reporting on these issues to Congress for more than a decade. End of quote. More than a decade. And nothing meaningful has been done to resolve these problems. Worse, the VA investigations keep claiming that the delays and subsequent cover-ups are caused not by gross negligence, but are simply the result of a lack of staffing. Not enough nurses, not enough doctors. GAO has been reporting to Congress about these delays for years, and they have told Congress over and over the GAO staff have found evidence that VA hospitals have tried to cover up wait times, fudge the numbers, and backdate delayed appointments in an effort to make things appear better than they are. Can there be any question that but for whistleblowers at Phoenix and Doran and some of these other places under investigation, that we still might not know about these problems? And I think the answer to that question is a resounding yes.
You've been listening to Putting Veterans First, a program designed to help millions of vets and their families receive the benefits and care they deserve. Putting Veterans First is a presentation of the NVRA, the National Veterans Rights Association.